Hi, I'm Dr. Michael Craig. Thank you, Jayu, for that introduction. I appreciate that. We're in Whitefield, beautiful downtown Whitefield. I have a great view from my office. And this is Dr. Krutivora. She's going to be gladly assisting me today. I'm going to be showing some things that I do with patients who are not getting results from other treatment types. In other words, if you come to a chiropractor with neck and back problems, most of the time we can take care of those neck and back problems. Not a problem. Sometimes, however, those problems persist. Sometimes pain persists. Sometimes the patients say, well, doctor, I've been treated for a week. Nothing seems to be changing. Now, there's a couple of things I can do to assist that. One of the things is that we've also got physical therapists on the premises, so if there's a way that they can help with a problem like that, I'm gladly referring the patients to physical therapists, Dr. Mantha or Dr. Savita. Now, in other cases, I consult Dr. Kruti. She has a different view on different conditions that she shares with me. Sometimes together we can come up with a solution. The third thing, and this is something that I do myself, and this is I check the energy levels of the body, because I've had several patients who have had neck pain, low back pain, problems that have persisted beyond what I consider to be normal or natural. When that happens, I begin to look a little deeper. And this means I check into the energy meridians of the body, into the chakras of the body, and even check in the teeth. Because sometimes root canals, and I'm going to cover this in just a little while, root canals can sometimes affect these meridians in the body and cause problems that persist for year after year after year. So let me just get started by just saying that the body has energy lines that run throughout, and usually from top to bottom or bottom to top. Most energy lines do not run transverse, which means that sometimes if a person has a scar, like if you have a scar here, or some women have scars after delivering cesarean. If that happens, sometimes the meridian lines are broken. When that happens, the meridians get affected, and there's a problem with those meridians, which in turn can affect the internal organs, and it can also affect the spine. So I want to test Dr. Kruti. I'm not real sure what's going on with her today. I suspect she has something going on, but I'm not real sure what that is. So I'm going to just use her as a demonstration. With your permission, I'll do that. And then we'll get started. So the first thing I do is I find a strong muscle. Usually that's the deltoid muscle. The deltoid muscle, either arm, it doesn't matter which arm. Deltoid muscle is very strong. It's also very available. So when I'm testing a deltoid muscle, I'm asking you, just hold this arm straight out like this, tighten this muscle here, and I'm going to press down just using three fingers, 3 pounds of pressure, and I'm going to ask you to hold, and she resists. And so many times that's how it works. You just hold the arm out. If I ask you to hold, you just sort of push against my pressure. Hold. Okay, so she has a strong muscle. Now this is a technique that I call, or actually is called, applied kinesiology, which was developed by Dr. Goodhart back in 1965, a chiropractor. And what it is a very useful diagnostic tools that many chiropractors use to determine underlying problems, hidden problems that don't show up in a normal exam or during a normal visit. So with this, I can determine what's going on. Now, I'm going to be touching different points, or she's going to be touching different points in the body which pertain to the acupuncture meridian lines. These are called alarm points. Alarm points are simply that. If you touch the point and she goes weak, then there's a problem. If we touch the point and she stays strong, that means there's no problem. It's a very simple lie detector test. Hold. Okay, just go weak for me. Hold. If it goes weak, that's a no. Hold. And that's a yes. So very simple lie detector test. If there's a weakness, that just means subconsciously you're thinking that's not true, or this is not good for me. The body has a very innate wisdom, and that wisdom speaks. And if you only know how to talk or listen to that wisdom, you can learn a great deal about your body. And chiropractors use this a lot. So what I'm going to be doing, Dr. Kruti, is I'm going to ask you to hold your arm right like that, and I'm going to test several meridian lines, okay? Hold. And I'm going to ask you to give me 2 fingers here, and usually I'll have patients give me 2 fingers, and I'm going to be pointing with these 2 fingers at different meridians. Hold. And this is the lung meridian. Alarm point, hold. And here's the pericardial meridian, alarm point, hold. And we're going to test the liver meridian right here, and hold for me. And that's weak, okay? Now she's weak there. Let's try this one, and hold. And it goes weak again. So she's got something going on with the liver. Usually in a lot of patients I see liver congestion or a fatty liver, depends on how you look at it. This doesn't mean there's something wrong with the liver. That just simply means that there's something going on with that liver meridian, with that energy, that's stopping her from getting well. And so a lot of cases, excuse me one second and I'll show you, in cases of liver meridian, I often recommend they go on Amazon and get something called organic liver support, which is a product that I recommend for a lot of people with congested liver problems. This really helps, especially useful for migraine headaches, things that pertain to the liver that you can't discover from other sources, okay? So, I'm gonna just check a few more alarm points. Hold and touch right here. This is gallbladder, that's okay, hold. And we check in with the heart meridian, hold. That's okay. Stomach, hold. And let's see, small intestine. And urinary bladder, okay, hold. Okay, now, there's a couple of other points. This meridian runs from the base of the body, between the legs, up the front to the bottom of the lip. So the alarm point would be the bottom lip. So I have you touch right there, hold, and you're strong there. Touch the top and hold there. Now this meridian runs from here all the way up top of the head, around the top of the head, down the back. And this meridian is called the governing vessel meridian. That when that meridian is weak, a lot of times there's a related problems with the low back, with the neck, or with the spine and hold. So I want to balance that meridian with your permission. And I'm going to go ahead and do some things. And I've got my little American acupuncture tool called Sparky, which I use, which creates just a little bit of a spark between, it's a connection point between this point and this point. Creates like a slight spark. And so it doesn't hurt, does it? No. Okay, so what I'm going to be doing is I'm going to be touching different points in that meridian to strengthen that meridian. So I touch right here, and I do right there, and it's kind of strange, but it works. And I go down the meridian line like that, and then I reach the bottom. Let's check her meridian here again and see if it held. Hold. And it's strong this time. So a lot of times that's how I balance meridians. Now I can also check the liver meridian. That was weak last time. And I want you to just touch the liver alarm point right there. And I'm going to put this liver support stuff here. I'm going to test this muscle again. Hold. Okay, so this makes her strong. So when it makes her strong and she was formerly weak, that means I know that this is good for that meridian and that condition. So I always recommend they get this particular supplement. There are other things that I do in the office for patients to work with energy meridians, to work with the chakras. Sometimes I will test different chakras to find out if they're closed or if they're open, if there's something going on in the body, because the body has all of these energy centers that are very, very important for the development of the organs, the tissues, and most importantly, the spine and the nervous system. So if you want to stay out of pain, by the way, simply means blocked energy. If there's an energy blockage, you're going to have pain in your body. This I've discovered over 40 years of practice, that pain can be eliminated fairly quickly. The underlying condition, however, can persist. And if it persists, then it will come back and you will have the pain again. This is why as a chiropractor, when I adjust the spine, a lot of times I will say, well, you feel great now, but trust me, the pain will come back. You need to come back a few times for us to balance your energy, balance your spine, and then the pain will stay away. What I want to check now is Dr. Kruti has a root canal, yes?
I do.
So one of the things that people talk about that we ask when you come in as a patient, do you have any root canals? And one of the reasons we ask that is because I've noticed that some patients just cannot get better. They have a low back pain or problem, they have a mid back pain or problem, it's not going away. And so I always like to check for root canals. And the reason I do that is because the root canals affect the meridians in the body. For example, you've got the different teeth will affect the different meridians in the body. And this is very important to test because if there's an underlying condition, a lot of times I will request that people go see a dentist to have the root canals removed. Now, I'm not a dentist. I'm a chiropractor, I'm not a dentist. I can only suggest that this is a problem. I cannot fix it for you. Sometimes I can fix it, sometimes I can get it to where it's non-reactive, as I call it. But if the tooth is reactive, and we're going to check to see if Dr. Kruti has a reactive tooth, and if it is, then she may need to get rid of this root canal. And hold, I'm going to test, hold, right, touch. I I want you to put the finger on the top of that root canal, and I'm going to test that. Hold and resist. Okay, so she's weak. All right, take it off and hold. She's strong. So that means that her root canal is reactive, and she probably needs to go to a dentist to have that taken out. Now, there's some things that I can do to balance that. A lot of times I do my American acupuncture again, and I can do some things like that, and it's a little bit shocking sometimes. I can also do the meridian lines like this, and since this canal is connected to the lung, the large intestines, put your hand over this way, a lot of times that's affected as well. So let's check and see if that made a difference. Okay, hold. And she's strong now, so it did make a difference. So a lot of times I will check the root canals to make sure that it's not interfering with the meridian lines. If it is, I fix it right there. And then I will check it the next time she comes in to see if it's still reactive. If it's still reactive, then I would suggest that she have a dentist take it out. From personal experience, I can say that these things don't really help. A lot of times there's either an infection, or at the very least it interferes with the acupuncture meridian lines, and you're going to have a problem with getting better, or have a problem with pain over a long period of time. So get your root canals taken out if you can find a dentist to do that. With that in mind, I want you to come see us if you have a back, neck, low back problem, headaches, any condition that involves the spine, the nervous system. Come see us. A lot of times we can help. If we can't, we'll usually refer either to physical therapy or refer to a medical doctor if it's a severe enough condition that needs some underlying care or medicine. Okay, so with that in mind, Dr. Kruti, thank you very much for helping me. I'm Dr. Michael Craig. This is Whitefield in Bangalore, and we ask you to come visit us someday and let us help you. Thank you.